right. We ready to go, Henry?
And you're on.
All right. Good morning, and thank you for joining this meeting of Health and Human Services. Today is Monday, July the 27th. Losing track of time. Today is Monday, July the 27th. Miss Kimberly Moss, could you call the roll, please? Thank you.
Griffin,
Here.
McCormick,
Present.
Conwell, Hairston,
Here.
Bashir Jones, Santana, Zone, Kelly,
Kelly?
Muted, but he's here.
Chairman, we have a quorum.
All right. Thank you, everybody.
Sorry about that. Just having trouble.
No problem. All right. This Health and Human Services Committee hearing or meeting is being held during the COVID-19 emergency declaration in accordance with Ohio's open meetings law, as amended by sub HB 197. This meeting is being held using the Zoom platform and is being live streamed on YouTube and on Cleveland's Channel 20. It can also be seen on the Cleveland City Council website and from Council's Facebook page, in accordance with Ohio Opens meeting laws and regulations. As amended by SB 197, notice of this committee hearing was publicly posted. So the way that this works, we'll give a brief overview. I know we have a lot of people today. This committee hearing will be conducted as all committee hearings in accordance with Robert's Council's rules and Robert's Rules of Order. The chair will facilitate the meeting and call on persons to speak. If you wish to speak, please use the raised hand option in Zoom. Please limit your comments to the matters before today's committee. As is usual practice, any actions to be voted on during the committee will be done by voice vote and called and recorded by the committee clerk. The following meetings held during the COVID-19 emergency declaration will be conducted as virtual meetings in accordance with Ohio's open meeting laws amended by SB 197. The public may observe these meetings on YouTube, Cleveland City Council, and on Cleveland Channel 20. For more information, go to Cleveland Council's website. That being said, today we're going to hear ordinance number 524-2020. This is more affectionately known as the sugary drinks legislation. What we are looking at is what we need to do as a city in order to try to give our children a healthy start. I just want to give a brief background before I read the legislation and then the amendment proposed by law. This legislation was introduced by Councilman Bashir Jones and myself, and we were approached by the American Heart Association as well as Neighborhood Leadership Institute and Kevin McDaniel and Don Slocum. When we were approached, we started investigating, looking if this is something we wanted to do. We subsequently were contacted by the Ohio Beverage Association, as well as the Ohio Restaurants Association, and several other folks whose industries will be impacted by any legislation that we put in place. Therefore, I have asked the two teams to convene and have a discussion with each other so that they can work through details of the legislation, and wherever they had an impasse, council will come in and make a determination on those areas that they had an impasse. I want to commend this group for coming together and really coming with a very good, very strong piece of legislation. And I do believe there are only approximately 3 or so areas that the groups could not come to an agreement with that we'll propose after we hear testimony. I'm going to first hear from Rachel after I read this, Rachel Scalish, our attorney for Cleveland City Council, and then I'll hear from Director Merle Gordon, who is the Director of Health. Then I will proceed to hear from Becky Watts, and she will call the members of her team that are here, that are proponents for this ordinance. And then I will hear from Kimberly McConnell and a few other representatives from the whose industries will be impacted by this ordinance. I do want to warn everybody, I want to make sure I hold a quorum. So please keep your comments brief as we can move through this hearing in an expeditious way so that we can make sure that we have the members that we need in order to make sure we have a vote. So in other words, you can be long, but don't be long-winded. Thank you. That being said, ordinance number 524-2020 to supplement the codified ordinances of Cleveland, Ohio, 1976 by enacting new section 241-43 relating to the sale of beverages offered with children's meals by food service operations, introduced by Councilman Blaine Griffin and Councilman Bashir Jones. I would also like to entertain a motion, entertain a amendment, which we're going to vote on any amendments at the end, but I want to read the amendment into the record that the legal department has given us from the city law department. And I do, this is just basically language to keep it consistent. And it says in section 1 at section 241.43E2, line 4, strike 10 days and insert 30 days. And in line 5, strike the director's decision to appeal shall be final, and insert a person aggrieved by a final decision of the director may further appeal to the Board of Zoning Appeals within 30 days after the director's decision. This was offered by Stephanie Melnick, Chief Assistant Law Director for ordinance number 524-2020. So I ask that we vote on that at the end when, if we have any other amendments. So at this time, I'll turn to Rachel Scalish so that she can give us the details and a very brief overview of what this sugary drinks ordinance for kids' meals actually entails. Rachel?
Thank you, Chairman. Through the chair, Ordinance 524-2020 enacts a new section to the Health Code that requires any restaurant that offers children's meals to offer only water, milk, or 100% fruit juice as the beverage. Restaurants may not offer soda pop with the children's meals. A customer can choose to purchase soda pop instead of one of those beverages offered. And a restaurant that does not limit the beverages in its children's meals will be given a warning on the first offense, charged $25 for the second offense, and $50 for a third and subsequent offense. The offering of the beverage limitation on the restaurant menu is evidence that they are complying with this section. That's it. You're on mute, Blaine.
Thank you, Rachel. Appreciate it. Next, I would like to hear from the Health Department. I believe we have Director Merle Gordon or Commissioner Kimball. So Director Gordon, if you have any comments regarding this legislation.
Sure. Good morning, Mr. Chairman, members of the committee, members of the public, and all the invited guests here today. Thank you for the opportunity to hear this piece of legislation. There was a hearing about this. I honestly can't remember. It feels like it was 25 years ago, but it might have been earlier this year. And there were a lot of comments that were made at the table from members of the community. And I think one of the things that was said multiple times is how critical giving young people the right kind of nutrition, the right kind of habits around food and choices is so critical early on. And sometimes it requires making some, providing limited choices of healthy options so that you know that the healthy option is the healthy choice, and making that as simple as possible for families and for children so that they're not battling what can be an overwhelming message from industry that is there to promote sugar sweetened items, food and beverages. So legislation like this is one way to combat what we know is a pretty significant health indicator in our community, which is obesity in children. And we are trying all things to address that and combat that. So this is one way to do that. We really applaud City Council for taking this on. I would also be remiss if I didn't say that we really also need to encourage all of these food operations to provide healthy children's meals as well. Often the choice for a child's meal is a deep fried piece of chicken or pizza or deep fried cheese of some sort. And so we really need to encourage all of these operators to provide healthier options for young people and for families that are affordable and that are attractive, so that and tasty, and all that can be done in a very, very healthy way. Commissioner Kimball is on. The food safety program is run out of the Division of Environment. Our sanitation officers do work very closely with food operations. And I know that they will be the ones who'll be working with them, especially if they have a children's menu, and making sure that this ordinance is complied with. Commissioner Kimball, if you had anything further to add, I would turn that over to you. If not, Councilman, those are comments from the Cleveland Department of Public Health. Please be safe.
Thank you so much. And Director, I really like your comment about healthy meals. And at some point in time, let's explore what that may look like. And, you know, if this council has the appetite in order to, you know, look at that as well at a future time. So thank you so much. I will say this is one of the first major steps of major cities that's really trying to introduce that. So this is cutting edge legislation that we're trying to do. That being said, I'm going to go to Becky Watts. And I believe Becky has a group of people. I know she has one of my favorite restaurateurs, Doug Katz, and just one of my favorite people, Margaret Larkins Pettigrew, with her today as well. So Becky, if you want to introduce your team and if they can make any comments, that'd be great.
Thank you so much, Councilman Griffin. My name is Becky Watts, and I am here on behalf of the Healthy Kids Meal Coalition. I am joined by several from our coalition, two of which will be making statements today, but I will introduce our whole crew. I'm joined by Dr. Larkins Pettigrew from University Hospitals, who is the board president at the American Heart Association in Cleveland. Dr. Janine Arruda, also with University Hospitals, Rainbow Babies and Children's Hospital, also a board member at American Heart Association in Cleveland. Doug Katz, chef and owner of Fire Food and Drink and several other restaurants in the Cleveland area. Valerie Gates, the executive director of the American Heart Association in Cleveland. James Meerdink, the Healthy Kids Meal campaign manager, and my colleague, Greg Kapkar, also here on behalf of the Healthy Kids Meal Coalition. So Dr. Larkins Pettigrew and Chef Doug Katz will be making statements on behalf of our group, and the rest of us are here to answer any questions at the appropriate time. So thank you so much. I will turn it over to Dr. Larkins Pettigrew.
Good morning, everyone.
Morning.
So thank you, Chairman Griffin and the committee for having me here today and for the great work that all of you continue to do for the people of Cleveland. Of course, I'm at University Hospitals as one of their endowed chairs, but I had the Office of Community Impact, Equity, Diversity, and Inclusion at University Hospitals. But here today representing my wonderful, wonderful crew at the American Heart Association, I am the president of the board of directors. So the policy that you're considering today is an important, positive, common sense step forward to make sure that our children of Cleveland and families are taken care of. It's also very timely that in directly addresses health equity issues that are all on the minds of all of us. I want you to, hopefully you read the op-ed that was in the Plain Dealer that really highlighted the issues that we're talking about today. So let me explain a little bit. First, we know the numbers when it comes to chronic diseases in Cleveland. Our citizens suffer from obesity, heart disease, stroke, and diabetes at higher rates than their regional peers. And certain zip codes are even more at risk. What's worse is that these conditions aren't confirmed or confined to adults only. Kids suffer from obesity and type 2 diabetes at increasing rates, and chronic health issues we find in adults can often be traced back to unhealthy behaviors and environments in childhood. So the American Heart Association has been working on this issue in Cleveland for many years now, most recently through the Healthy Cleveland Initiative. And I've been a part of this for a very, very long time. Over the last year, we've built a strong coalition in support of the Healthy Default Drinks policy. So nearly 40 Cleveland organizations have signed on, including both large health systems and federally qualified clinics, advocacy organizations like the Diabetes Association and Children's Hunger Alliance, community development corporations, and restaurants. So healthy equity champions like the NAACP, Center for Health Affairs, and the Black Child Development Institute have also come out in support. We've also reviewed support from over 500 Clevelanders in our wards through postcards collected by Neighborhood Leadership Institute. What attracted all these groups and individuals to this cause was simple: the health of our Cleveland kids and the ability of the City Council to make a difference for them by taking this simple step. So let me just review what the simple step is before I make my final point about health equity. The policy itself is straightforward. It instructs restaurants that include drinks with their kids' meals that must offer a healthy option as the default. Healthy options could be low-fat milk, water, or 100% juice at the appropriate size. They can't be sugary drinks like sports drinks, energy drinks, or soda. Restaurants don't have to offer all of the healthy options, just one. Tap or bottled water are great options as well, as are flavored waters and low-fat flavored milks. By making sure that the defaults are healthy, we're making it easier for parents and kids to make the healthy choice. We're also instilling healthy eating and drinking norms that can have long-lasting effects for health and for our health system. Finally, we're offering protections for our kids similar to those that already exist in the schools, including CMSD in early childhood settings where kids are served healthy, appropriate drinks. The policy itself is the result of a constructive collaboration between American Heart Association and Kids Meals Coalition partners, the Ohio Restaurant Association, and the Ohio Beverage Association. And here's why this policy is especially important now. Both the COVID pandemic and a reinvigorated social justice movement have made it abundantly clear that the ability to live your best life isn't afforded equally in all of our citizens. Those who are of the Black and Brown communities have been affected the most. It is these communities that we see and we witness a significant number of obese children who remain obese through their adult lives. There's a stark difference in access to healthcare, grocery stores, safe drinking water, and green spaces. City Council bravely said as much with your declaration of racism as a public health crisis. When it comes to kids' meals, things are more challenging for some kids than others. In neighborhoods without access to grocery stores, restaurants, and fast foods, these aren't luxuries. They are a prime source of meals and daily calories. These are neighborhoods who are disproportionately targeted by unhealthy food and drinks and drink ads. Many of our Cleveland kids confront these challenges daily in getting healthy food and drink. Making these meals healthier will solve all of these issues, but will not solve all of these issues, but passing this policy will begin to address the health inequities that exist in our communities. And that's why we can take action on behalf of the kids today. Our coalition has adopted the slogan, #ServeKidsBetter. And that's exactly the opportunity that the Health Committee and the City Council have with this policy. I thank you for your opportunity to address this issue today. And I hope you'll take the opportunity to serve Cleveland kids better by passing the Healthy Default Drinks policy. So I'll stop there. Thank you.
Thank you, Ms. Pettigrew. Mr. Katz?
Thank you, everyone. Thank you, Chairman Griffin. Let's see. Thank you to members of the Health and Human Services Committee for inviting me to speak here today and for the important work you do to promote health and wellness in our city. I'm Douglas Katz, chef and owner of several restaurants, including Fire Food and Drink at Shaker Square and Romance Cafe at the Cleveland Museum of Art. As someone who has fought hard to lose weight as a young adult and as a child, I understand the importance of starting healthy habits early. I also understand that restaurants play a huge role in shaping eating and drinking habits for the whole family, but especially for kids. Similar to menus created for kids at school and daycare, some thought and consideration needs to go into the kids' menu. The current health crisis has reinforced this for me. Healthy food and drink choices are essential to preventing chronic conditions such as obesity and diabetes. It's a tough time for restaurants, but our commitments to serving our customers is as strong as ever. In times like these, we want to be part of the solution, and we can do this by making it easier for parents. At my restaurants, we try to provide many healthy food and beverage options for our guests. Right now, that's only on a takeout and delivery basis, but we look forward to continuing with the healthy menu when we reopen the dining room. And that includes our kids' offerings. As an owner, I don't believe that this policy will be a burden to restaurants or an obstacle to us reopening. There is minimal cost to a menu change, and this is something we do routinely anyway. Also, the implementation timeline will allow restaurants plenty of time to get educated on the policy and choose what drinks to offer. I support the healthy default drinks policy, as do a growing list of chefs and owners across Cleveland. And I applaud City Council for taking a proactive step to encourage kids and health. Thank you.
Thank you, Mr. Katz. Becky, do you have anybody else?
That concludes our statements. Thank you so much. As I mentioned, we have a team here to help answer any questions that may arise. Thank you.
Thank you. Brevity always is helpful, so appreciate that. I will tell you that there have been others. Several of us have received support letters from community members as well as other organizations in support of this. Anybody who would like to submit that or submit letters of support for this, Ann Tilley has been, raise your hand, Ms. Tilley, if you could. Ms. Tilley is the person who has been collecting all of the letters in support and any other recommendations regarding the letter. We have regarding the ordinance. We have read through all of those. Believe it, we have read through all of those. So the comments have been taken into consideration. With that being said, I'm actually going to ask if Ms. McConville can actually take the lead role from the Ohio Beverage Association regarding some of the folks who don't want to call opponents of this legislation. I want to commend them because they actually made some recommendations and offers of how the legislation could be better and how we can do this without a tremendous amount of impact to their industry. So Ms. McConville, and I think it's a powerful statement to have all of these different industry leaders together talking about this issue. Ms. McConville, you have the floor and you can announce anybody with you. And I do see Scott Higgins, if he would like to make a comment, or anybody else from that team, as well as Todd Bowen, they're welcome, okay? Ms. McConville, you first.
Perfect. Can everyone hear me okay? Great. I once spent an entire call muted and it was very frustrating. So good morning, Mr. Chairman, Vice Chair McCormick, Council President Kelly, and all the wonderful members of the Health and Human Services Committee. I will be brief. I did submit a written statement. I don't like to read testimony, so I just want to give you a little background on who the heck is Ohio Beverage Association, who am I? It's my pleasure to represent the non-alcoholic beverage industry statewide in the great state of Ohio. So we are about 10,000 employees strong statewide, about a $7.5 billion economic driver for the state of Ohio. I represent members like Coke, Pepsi, and Keurig Dr. Pepper, who make some of the world's most recognized brands, not just of your favorite carbonated soft drinks, but of water, juices, teas, You name it, they make it, hundreds and hundreds of products with no calories, low calories, smaller portions. And our members do have a long-standing commitment to working on strong, healthy community issues. So we do not sidestep uncomfortable discussions or important discussions like this. In fact, many of my colleagues around the country have worked on ordinances just like this. So additionally, our National American Beverage Association has worked with the National Restaurant Association on default drinks policies. So this is really not new territory, but the heart of everything that we do as an industry is to provide really transparent, clear information on our ingredients, on the calorie counts, and then we empower consumers to make choices that are right for them. So it's not just information, we back that up with lots and lots of choices, including low and no calorie drinks, smaller portions. So that's sort of the backbone of how we go to business, and partially why I am here today at Councilman Griffin's invitation. So before COVID turned everything literally upside down, we had some very positive, very good meetings with the Heart Association and their team. So I want to commend them for sitting at the table with me and with Todd Bowen from Ohio Restaurant Association, and for dialoguing with the dairy producers. I think the best policy is when government, the private sector, and public health can all come together and at least hear each other out and try to find some common ground. So I think what you have in front of you today really reflects some very good intentional work. I'm very proud of the efforts on everyone's part. And with respect, Mr. Chairman, I think we just do have one issue and one suggested, I'm going to call it as a non-lawyer, like a legal tweaking that we would appreciate the committee entertaining. And I think there might be more detailed discussion on this at the end, but let me just sort of outline, if I could, what change we're looking for. So we came a long way in our discussions, but from our point of view, there is a sticking point on the size of juice in the proposed ordinance. So in section 241.43 B as in boy 3, we would just like to see that 6 ounces change to 8 ounces. And we have a couple of reasons for this. One, we believe making this change will put Cleveland on par with cities like Philadelphia, New York, Baltimore, and several other jurisdictions who have done similar ordinances, and they have used the 8 ounces. I talked earlier about American Beverage Association and National Restaurant Association developing a national model policy. That model policy also has 8 ounces as a suggested serving size. And then the third reason is just a market reality. We had lots of conversation with restaurants, with our members, and really terrific community partners. And what we determined was a 6 ounce serving is not readily available, readily available in the restaurant channel. So we believe 8 ounces is the right decision to make, and we would respectfully ask for that change. And the second one that I'm calling the legal tweak is just in the compliance section. So, and Todd Bowen can certainly speak to this from Ohio Restaurant Association. But again, in section 241.43, E as in Edward 3, just a small clarification on how restaurants can demonstrate compliance with your new ordinance. Just inserting a little description before the word beverage to say primary or suggested beverage, meeting the limitations set forth. So those those are the changes we would like to see. But I want to express my appreciation again to you, Mr. Chairman, and your sincere desire to find common ground. It was a very refreshing approach to a policy that I think that our members could be very supportive of. So that concludes my remarks. Thank you.
Thank you, Kimberly. And as I stated earlier, what we're going to do is hear any of the recommendations. And I do believe I'm keeping track, but between Ms. Tilly and Rachel Scalish, and also our city attorney, is our city attorney here? Our city attorney will be keeping these recommendations. And then after we hear from our panelists, then as council, we'll have that discussion and then figure out what we need to do, okay? All right, that being said, I believe Todd Bowen from the Ohio Restaurants Association was gonna say something, and then Scott Higgins. So Mr. Bowen, did you wanna say anything?
Councilmember Griffin, if it'd be okay with you, I'd love to maybe have Scott go first, so we hear from both of the beverage folks, and then I'll kind of summarize how they both impact restaurants.
Okay, great. So Scott, floor is yours, sir.
Thank you, Councilman, and to all of you who have worked so hard on the policies that you're engaging in right now. So my hat's off to all of you for taking the time to really seriously consider children's health. The dairy farmers and the Ohio Dairy Producers Association and all of our milk processors throughout the state of Ohio have spent over 100 years through our National Dairy Council and all of our local programming to assure children's health and access to healthy and nutrient-rich dairy products throughout their lives, starting out in school and in their homes. One thing that I simply pointed out to the councilman the other day was our concern about lowering the caloric value in a single serve glass of flavored milk to 130 calories. Just to make it clear, the dairy industry has been very much a part of always looking for innovative solutions to reduce the caloric intake and content of our flavored milk beverages. So we are on a mission to do that. However, at the present time, availability of chocolate milk and flavored milks that are lower than 150 calories are very difficult to come by. So I simply wanted to point out that current state law, based on Senate Bill 210, which was negotiated many years ago in partnership with the health and nutrition community and school systems, was that flavored milk in schools would be 150 calories. And so also at a federal level, there is no stipulation on caloric content of flavored milk. So therefore, point being this, right now, there are no dairy products readily available to your restaurants that can meet the 130 calories for flavored milk. Our disappointment is that if you implement a law like this or rule like this, it simply eliminates children from having access to a flavored beverage which has all the nutrients that you would want a child to have access to. However, when they go home, they can get it out of the refrigerator, or if they go to school, they can get it there. But in a restaurant, you wouldn't be able to access that. So respectfully, I just ask that you would reconsider and put your calorie limits at 150 calories. And then just as a statement of support, we as a dairy industry know that there are other brands out there that have successfully found new ways to create formulas that can achieve that 130 calories, but it is not system-wide yet. We as a dairy industry will continue to work aggressively to find ways to do that. Just one concluding thought. When you look at the caloric content of flavored milk, keep in mind that 12 grams of those sugars are naturally occurring in the milk as it is, in non-fat and 2% or even skim milk, and 1%. So the added calories of added grams are only 13 grams. So keep in mind that those are naturally occurring sugars. And as a result, the child has all the benefits of the nutrients of vitamin A, vitamin B, calcium, vitamin D, phosphorus, and other things that help make strong bones. So our request is simply go back to 150 calories, and let's continue to work together as an industry, along with our colleagues in the Beverage Association, the restaurant industry, and our dairy processors through the Ohio Dairy Foods Association, and innovative solutions with our dairy processors and manufacturers to continue on the path to reducing caloric formulations, but give us some time to work that through. Thank you very much, Councilman, for your time.
Thank you so much. Thank you so much, Mr. Higgins. And then I think that leaves us Mr. Bowen, Todd Bowen.
Thank you very much, Chair Griffin, President Kelly, and other members of council, and the whole group that's here today. Really appreciate everyone taking your time on a Monday morning to talk about kids' meals. And I'll be brief. Certainly, a couple of things I do want to highlight. Number one, I just want to echo what Kimberly said, that both the restaurants and the beverage industry have worked already. And for a number of years, I would say probably the work goes back starting about 10 years, but really it's something that we continue to work toward. And it's part of the Kids Live Well initiative. And if you just Google National Restaurant Association, Kids Live Well, it'll be the first thing that pops up. And restaurants really have worked very hard and have been industry leaders on healthy beverages and healthy options for kids' meals. And I would say we are probably at about 80% of the major restaurants that abide by the Kids Live Well initiative. And certainly those meet much of what we're talking about here today. So I certainly appreciate that work, and then applaud your work in kind of echoing, and Cleveland being a leader on kind of codifying those for Cleveland. So that's important, and appreciate the opportunity to work together on that. And then I'll speak very quickly to the two that Kimberly mentioned and what Scott mentioned. And they really are very small changes, from 6 ounces to 8 ounces. And I do know, obviously you can find juice at different sizes, but the small change from 6 to 8 really will allow some of our major restaurants to not have to kind of upend their supply chain to get that. Wendy's was one in particular. Theirs currently is at 6.75 ounces. So if we did it to 8, that would really easily encompass that. And then what Scott talks about with the milk and the calorie count, that certainly makes a lot of sense to me. What I want to make sure from a restaurant's perspective is that we can do this, continue to do this well, but that it's something that fits within our current supply chain. That's really important to restaurants, and not only doing this, but embracing it and shouting out how much they're doing to help with this sort of an initiative. And then the third, that really is just a legal clarification. And I, not being an attorney, I have a hard time seeing what really the differences are in that, but that really came from our partners at McDonald's and even a couple of our Cleveland McDonald's operators, who said that language fits better with what they've seen in other states, and it really does help them that just kind of stays the same across, helps them keep track of it more easily, et cetera. And their attorneys just thought it was a slightly better way to say that. So with those changes, we would not only be thrilled with this legislation, will certainly be something that we shout out everywhere we can. And we've appreciated the opportunity to be a part of the conversation. And then I would certainly be remiss if I didn't end with so many Cleveland City Council folks and others here to just, I think you can all imagine how devastated, we're all devastated by the public health and economic crisis that the COVID-19 is, but restaurants are on the front line. Restaurants are really struggling. Restaurants are going to continue to struggle. And I would just say, in every way that you as leaders of Cleveland have to be supportive of this industry, I'm afraid already that a number of restaurants are not going to come back. So anything that you can do, and I know you have done some things with expanded patios, et cetera, I applaud that. And just say that anything else that you can do creative, we're open to being parts of those conversations. Thank you for the opportunity today.
Thank you, Mr. Bowen. And just on a side note, my colleague Carrie McCormick was very instrumental in really putting that together. So you're actually on here with the vice chair of this committee, who was very instrumental in helping push that as well. So just to give you that heads up. Just for my council colleagues, and before I move any further, I do have a question for the American Heart Associations, and I'll pivot to Becky. It looks like I have received the correspondence from the representatives from the American Heart Association that they are okay, and I'll defer to Becky on that, with the increase going from 130 caloric limit in the flavored milk to 150. Is that correct, Ms. Watts and the American Heart Association, number one? And then number two, what is your opinion on the 6 ounce to 8 ounce before council begins to deliberate, and before I pivot to my colleagues for questions and answers?
Thank you so much, Chairman Griffin. I appreciate the opportunity to respond. I'm actually going to defer to James Meerdink to ask him to address those questions.
Thanks, Mr. Chairman. So the milk issue, we are okay with the move to 150 calories. There's also an alternative, just moving to an 8-ounce serving size, which we think might be easier for restaurants to implement. So we would be okay with either of those options. On the juice size issue, just to back up a little bit, I do want to thank the Restaurant Association and Ohio Beverage for a really productive dialogue on the policy. The bill we have now is certainly an improvement over what we began with, and it's because of their input. And so I want to acknowledge that. The juice size issue, we started, a lot of our coalition members are dietitians or they're direct service providers. And so we started with actually no juice. And so then we got to have juice as an option because of input from Restaurant and Beverage. And then we moved from a 4-ounce to a 6-ounce serving size. And the reason we were hesitant to include juice at all or to move to a higher serving size was really the science. The science has evolved, and now serving sizes for juice that are recommended for kids are actually quite low. And so we're comfortable with the 6-ounce serving size. We really don't think we should go higher than that based on the science and what's recommended for kids. The other thing to add to that is, I acknowledge what they said about the supply chain, but we have looked and we do think there's 6-ounce servings available. I have a couple here. It's really tough to see, but this is Honest organic apple juice, 6 fluid ounces. I think this is Target. I have another one from Walmart. And then we also have some options available from Gordon Food Service. So we do think these things are in the supply chain. They're also being used at some early child care centers and other places that have figured out how to integrate these into their supply chain. So while we do want to be convenient for restaurants and to implement the policy, we also want to stick with the science and be up to date in the, in the nutrition that we're serving our kids. So that is our take on the juice size. We'd really like to stay at the 6 ounces. We think it's a good compromise.
All right, thank you for your input. I'm going to pivot now to council. You heard the presentations. It looks like we have 2 sticking points, and that's where council is going to have to make a decision. And we'll make that decision after we have this discussion. What I will tell everyone is that I can read an amendment, but a motion to accept an amendment has to come from the floor from one of my colleagues. So I'm going to start, if I can, with the co-sponsor of this legislation, my colleague Bashir Jones, and then Vice Chair of the Health and Human Services Committee, Carrie McCormick. Councilman Jones, you have the floor.
Thank you so much, Councilman Griffin and Chairman Griffin. This is such an important topic. Lately I've been, it's been such a, the violence that we're beginning to see has so many different factors. If you look at the what, you're going to think that Black and brown children and people are a bunch of animals. But if you look at the why is this violence the way it is? Why are our communities like this? Why? Then you'll begin to see what are some of the issues that are bringing us to this point, whether it's the air quality in our communities, whether it's the lead in the soil, or probably most importantly, the food that we eat. Medicine, our food is medicine. It really is, man. And I just wonder, what impact does our diet have on our emotions, have on how we feel about ourselves, how we feel about the community, so forth and so on. So when this was brought to my attention, I was just like all for it. If you go into our local stores, Chairman, you've seen these drinks before. You got these big drinks like this big. It don't even say grape, man. It says purple flavor. Yeah. But we just automatically knew, that this is grape, or it has red flavor. We knew that this was cherry, 0% fruit juice. And, you drink it and you're thirsty in 2 minutes, you know, and children come to school with the sugar water in their system. And then we wonder why it's hard for them to pay attention. It's hard for them to do well in school. And then hence, you know, they drop out of school, and then hence they end up in trouble. Then it creates a generational cycle of poverty, of violence, and of crime. So I'm really excited about this. I have 2 amendments I would like to bring and at the appropriate time, Chairman, but I thank you so much for really making sure that this is a part of this committee. I'm very happy to see representatives from the restaurants and the beverage companies, as well as working with the American Heart Association. So food is medicine, man. Food is medicine. Sometimes, Chairman, man, I have dreams of running, man. In my dreams, man, I'm like running from somebody, and then I remember I ate a bag of Skittles that night, man, and it just messed me all up, right? So food has an impact on the emotions and has an impact ultimately on how far we can go in our lives. We change our diet, we change our existence. And this is extremely important. So, Chairman, I'm all on board. I appreciate your leadership on it. I'm happy to see everyone coming together to make this happen. And hopefully we can push this along and get this implemented, especially during this time when building our immune system is the only way to defeat, along with the mask, to defeat this COVID-19. Thank you, Chairman.
Thank you, Councilman Jones. Appreciate that. And I used to drink that purple drink. I had to give it up. All right. Councilman McCormick, and then Council President Kelly.
Thank you, Mr. Chairman. And after our basketball games, we would either do the grape soda or the orange soda. So I probably not an ounce of real grape in that, but it was really good, though. I'll tell you that back then. But I agree with Councilman Jones. You were thirsty about 10 minutes later. Thank you, Mr. Chairman, for hosting this conversation. And as always, for your diligence in seeking consensus and policy. We saw that on lead and other things. You know, some people want a policy done tomorrow, but that doesn't mean it's a good policy. And I appreciate you always being thoughtful and listening to all sides and being a diplomat and ensuring that the city is getting a good policy, not just the one from the loudest person in the room. And I don't say that specific to this ordinance. This has been a really collaborative process. But as we know, in past years, you know, you've really been able to take in information and feedback and put out a good result. So I just want to thank you for that. And to everyone on the call today, I appreciate that. Chair, just a few questions of this ordinance, and I think it's really come a long way in a positive manner. So I really appreciate that. And I'll just say from an introductory standpoint, it's been incredible to me to see how devastating sugar is. You know, and I wasn't aware of that, quite frankly, growing up, but now as I learn on a personal level, it doesn't exist in my home. We've cut it out of almost anything we can when it's added or elective. And I really find myself also paying attention to labels now, specifically for sugars. So, you know, it's something that as we learn more about how, you know, impactful processed sugar is on our community, on our health, and from a negative perspective. So I appreciate that conversation. Chair, just a couple quick questions on the process. First of all, I'm supportive of this legislation, and I appreciate, Chair, you working with me on that. From a standard, through the chair, excuse me, I've been gone for a couple of weeks, getting back into it, to the health director. Director, from a capacity standard and for getting the health department ready to work, you know, handle this ordinance, what measures or are you confident that you're able to put the measures in place in order to work with our restaurants over the next 6 months? I understand the ordinance takes effect in 6 months. So what does that look like from the department perspective? from a capacity perspective? Is this something that we are able to embed in existing interaction with restaurants, or is this going to be a new process? Director Gordon.
Right there.
I'm sorry, Mr. Chairman, to the councilman. I was distracted for a moment. I had two other calls. Would you mind just repeating the question real quick? Or Councilman or
Thanks.
Commissioner
Yeah,
Kimball,
sure.
can you answer?
No, no
Sure.
problem, Director.
Yeah,
I
Commissioner
imagine.
Kimball.
So through the chair to the health department, this will be embedded in our normal activities with food operations. So as we go in to inspect, this is just be one more step that we would have to make a review of their menu education prior to this rolling out. So as we enter these establishments, we will provide documentation, education, and once it gets up and running, then as we continue to go in, we will be able to enforce.
Thank you. And Chair, to the Director of the Commissioner, as always, I think what's judicious of us in these conversations is to think about that restaurant, that small business, that it maybe is not as tuned in as big brands or as, award-winning chefs, as much as we love them, and I represent quite a few of them, and we're proud to do so. How are we, and I would send this question to the city, but also to the American Heart Association on the call today. How are we being proactive specifically to reach small little mom and pop businesses in neighborhoods that might not be as plugged in as others, to educate folks proactively on these changes?
So, Mr. Chairman, to the councilman, I appreciate the question very much. And I think this is really where the community partners play a significant role in doing that outreach and education to the business owners and to these operations. As Commissioner Kimball said, we do what we do, but we're the licensor and we're the enforcers. And so while it is still our role to make sure that health promotion education is out there and we will do our part, we're really relying on all these. It's great on Zoom. You see everybody's lovely photos and heads on the screen, but we will really be relying on them to do a fair amount of that outreach and education, and also to help them if this is through procurement or through other means, to try to make sure that they have the access to whoever is providing those healthier beverages for the children's meal. So I will turn this over. I'm not sure who else can answer that, but maybe Becky, you can start. And
anybody from the
Yes.
Heart Association?
Yes, I will turn that over to Valerie Gates to talk about the education and working with local restaurants.
Great. Yeah, we are committed to helping in any way that we can with the Department of Public Health and with the restaurants. We have some plans to make some informational resources, maybe some videos for different audiences. So we stand ready to assist with that, and think that could be helpful for the long-term sustainability.
Great.
Yeah, I appreciate that. And I would just say too that I appreciate in the ordinance that step one of non-compliance is a warning. And I would just say that as we go through the next 6 months to a year, we know that our restaurants are struggling significantly with COVID and everything that's going on there. I don't need to explain to folks on this call. I don't say that to say that we shouldn't move forward with this ordinance. I say that to say, ensuring that we're working with folks so that this is a evolution of consumption of sugary drinks versus a hammer down on small businesses and restaurants who are, trying to simply keep their doors open at this point. And as we move forward in that process too, I represent an area along with Councilman Santana, who had, we have a large Spanish speaking population. So thinking critically about how do we ensure that, we're being inclusive, whether it's, from a language perspective or otherwise, just to keep that on our radar. And the other, and I'm just curious, Mr. Chairman, to the group, and this is not, I promise you, this is not a what about question, because those drive me crazy, people that avoid the main topic and shift focus. But to the point of sugary drinks, I think this is a good first step. and again, I'm supportive of it. Any, quite frankly, grocery store or corner store in the city of Cleveland, whether it's the fanciest one in the city or the smallest one, the 2 liters of pop and sugary drinks are everywhere. So I'm wondering whether it's from a national perspective or locally to the American Heart Association, is there a conversation about whether it's education or working with distributors of folks, can easily buy these things and, take them home as well. I'm not arguing for a ban on Coke. What I'm just saying though is, from a broader perspective, we know the restaurants are one point of sale for sugary drinks, but obviously our supermarkets or corner stores and things like that are another point. So I'm wondering if there's been any conversation on that.
Chairman Griffin, this is Jamie from the Heart Association. I can just answer that briefly. We, as part of this campaign, we haven't gotten there. We haven't gotten to the retail establishment, that venue at all yet. But we would certainly like to work with council or council members on certainly awareness building in that setting. We have materials that have been used in other places, and so we'd love to approach that. And we do a lot of work through Healthy Cleveland and through other initiatives that do get to those corner stores and that kind of neighborhood level. So we'd love to explore more about that.
Kimberly, you had a comment to make. Kimberly McConville wanted to respond to that.
I do. Thank you, Mr. Chairman. To the chairman and Councilman McCormick, as an industry, again, I represent pretty fierce competitors, Coke, Pepsi, and Keurig Dr. Pepper. And when they come together on initiatives, it can be quite powerful. So our latest is an initiative called the Balanced Calories Initiative. And we've set a pretty big goal of reducing beverage calories 20% per capita by 2025. So part of that strategy is, of course, offering more things with low and no calories, waters, and smaller portions of maybe that favorite grape drink from years ago. That's funny. I drank it too. But the strategy definitely involves retailers, particularly smaller convenience stores, bodegas, and really leveraging the relationships that our members have with store owners to make sure they understand the depth of the portfolios that all of our members make, so that if you have a small C-store owner who believes his customers only want full calorie soft drinks, this initiative will, again, leverage those business relationships. So sampling in store, offering coupons, helping with design so that water is a more immediate or eye-catching choice. So I think there's lots of really good work already underway on behalf of our industry and the retailers. So we are, we hear the message. We are definitely working on that. So thank you for the question.
Thank you so much. And Chair, I would just say as in conclusion, I appreciate the Department of Public Health and the American Heart Association's coalition. Again, especially keeping in mind the economic impact that COVID has had on our restaurants and our small businesses, that we really move forward with this legislation in a collaborative way that is not necessarily leading with punitive measures, but education and working with restaurants and those types of things, so that we're ensuring that during this tough time for these small businesses, that this is seen as a collaborative effort, and I know it will be. I'm just wanting to make sure that's on record, that we lead with that motivation to work collaboratively and together. Thank you, Mr. Chairman.
Thank you, Councilman McCormick. I have Council President Kelly.
Thank you, Mr. Chair. I want to thank you and the sponsors in the committee and all of our partners. Just a real quick reference point. I was at a meeting of council presidents, and I was talking to the council president of Philadelphia, and they said their sugary drink ordinance nearly killed him. It was just so contentious, and it was so angry, and everybody was like just at each other. He said it was one of the worst experiences that he went through. So I want to commend you for building the coalition that made this possible. It sounds like we have tremendous amount of buy-in, and everybody is generally on the same page. My suggestion, Mr. Chair, is that since we have general agreement on everything except for the 6 to 8 ounce issue is my perception. For your consideration, Mr. Chair, could we, because there seems to be an issue of supply chain in terms of what's available, and you know, I assume that that those that are in the beverage business know that, but I also assume that the Heart Association has good knowledge as well. What if we were to set a phased, for that particular issue, what if we phase that in for 2022 or some later date to allow the industry to adjust and to get to the 6 ounce level from 8 ounces? So I'll just put that for your consideration and for our guests. And that's all I have, Mr. Chair. But thank you for your leadership on this, and thank the other sponsor, Councilman Bashir Jones, and thanks to all our partners.
Thank you, Council President. And I think what I would like to do is hear if that's something, you know, what Council President just put a suggestion out there. Anybody in the industry, Ms. McConville, would you like to respond to that, or anybody?
I'd actually like to defer to my colleague Todd Bowen if I could, Mr. Chairman. But it is, I will say once again, it is a supply chain issue. Gordon Food Service is not, larger restaurants don't push a shopping cart around Gordon Food Service. So yes, you might see this on a store shelf, but the supply chain for restaurants is very different. So I'd like to defer to Todd Bowen for a little more discussion, but it is a supply chain issue.
Mr. Bowen?
Yeah, thank you very much. Chairman Griffin, Council President Kelly, for that suggestion. Certainly, I do think phasing that in is better than just adopting the 6 ounce today. I do think, I still would continue to say that 8 ounces better reflects consistency within other states, other cities that have done this. It gives greater flexibility. So, you know, I would be hopeful that we might be able to amend that legislation today, but if unable to do that, certainly your suggestion of putting that off. The Kids Live Well initiative continues to be updated, and as the supply chain comes out there, they do change that. So I think when that becomes available, that would actually become probably the default that most folks would use anyway.
Council President, any follow-up remarks?
Yes, I just think that, you know, there's a reasonable solution that's out there. Everybody seems willing to get to an ordinance that we can all agree upon. I think that we as legislators and fact finders have to make sure that we know what we know. And I think that the supply chain issue of what beverages are available is something that we don't quite have the perfect answer on right now. That's why I just, you know, if it would for you're in the committee's review, that if we were to put this in place at a time that allows the industry to adjust, that might be something that is more palatable to everybody, and it would meet people's goals. So I'm just put that out for the committee's consideration, but I just think that we've come so far in a cooperative spirit. I just want to complete this ordinance that way.
Appreciate it. I'm going to hear, I don't see any hands from any of my other colleagues. Am I missing anybody? Okay. All right. So we're at a phase where we basically need to just make a determination on amendments. If I'm hearing no objection and I cannot make an amendment from the floor, increasing the amounts in section 241-43 from 130 to 150 is something that this council is willing to make an amendment to do, as well as the language issue that was brought up about clarifying and making unified language. And I believe somebody might need to help me. Did they capture where that's at? I think that was section E3 under civil penalties. So do we have an agreement from this council? And if there's a motion from the floor, I'll accept that motion before I move to the 6 ounces versus 8 ounces.
Mr. Chair.
Yes, Councilman Harrison, you have the floor.
Thank you, Mr. Chairman. I just want to be clear because I know that Scott and I believe Todd both had, and I believe James from the American Heart Association mentioned about removing the 150, but rather supportive to go to 8 ounces. Is that also a factor, or are we just looking at the issue from 130 to 150? So we're not dealing with the issue of 8 ounces. It relates to the milk serving size, I believe.
Yeah, just the milk serving size right now.
Right, but there was 2 discussions on that, going to 150 or just simply going to 8 ounces versus for the milk versus the 150 threshold, 130 threshold.
Mr. Higgins here? Do you want to clarify that, Mr. Higgins, your request?
Yes, first of all, the 150 calories is for 8 ounces. So if that's what the council decides to do, then
got it. Okay.
Be available to deliver that. Thank you.
Rachel, you have any clarification on that, Rachel? All
Yeah,
right.
I just wanted to mention that through the chair, the 150 calories would be consistent with the state law. So you know, instead of saying 8 ounces, which is the same thing, if you stay with the 150 calories, it's stay consistent with the state law.
Okay.
Okay, there we go. I knew there was back and forth, so I wanted to be clear on what the relation was.
All right. And actually, I apologize if I'm not mistaken. There's 3 amendments. It's the one that the law department has submitted to us that we need a motion from the floor for. There's the one moving from 130 to 150. And then there's the clarification language under civil penalty, section E, number 3, for clarifying language from that is more consistent with what is going on. Is that correct, attorney? Or
yeah, Mr. Chairman, that is the law department amendment, the clarification for consistency under the state code.
So when we start there, Chair.
Say that again.
When we start there, start with that.
That's what I'm trying to get to, because we need a motion on the floor for those 3. Those are 3, right, Rachel? 3 separate?
No, it's just one amendment.
Okay, so we're making the amendment on the 130 to 150 and also the clarification language, right?
Why don't we make the amendments that the law department suggested first?
Okay.
Which is the one that you read in the beginning of the meeting.
All right, so do I need to read it again, or do we just need to have a motion from the floor?
Well, you shouldn't need to read it again, except that I'm not sure that everybody actually has the amendment in front of them. But what it does say is it instead of 10 days for the director of health to make a decision, it increases it to 30 days, which is in line with what is usually in our code. And it also strikes that the director's decision on appeal shall be final, and instead allows a person who does not like that director's decision to go to the Board of Zoning Appeals within 30 days after that decision. That again is consistent with our code.
So,
Mr. Chairman,
yes, Mr. McCormick.
I move to amend the language as was just read by our attorney.
Do I have a second?
Second.
All in favor?
Aye.
Any opposed? Discussion? Motion carries. All right, the second one is from 130 to 150, right? So do I have a motion from the floor to amend? Yes, that's Councilman Bashir Jones.
Yes, Chair. Yes, sir. Chair, I make that motion to move from, this is the milk one, right? From 130 to 150. Yes.
Yeah.
I make that motion.
Second.
So that's been moved and seconded. All in favor?
Aye.
Any opposed? Any discussion? Motion carries. All right. So those are the only 2. Now we can talk about the juice size, right? Or we got one more, Rachel? Could you read the one more, Ms. Kalish?
Yeah, well, this was offered by, through the chair, and I apologize, was offered by one of the, well, it might have been Ms. McConnell. In E3, they wanted to kind of make some clarifying language and insert primary or suggested beverage meeting the limitations set forth in B. Is that the correct amendment?
Ms. McConville, is that the correct amendment?
Mr. Chairman, yes, that is the legal tweaking change that we requested.
All right, so a motion has been read, and Ms. Kalish has read the amendment that is being proposed. Do I have a motion from the floor to accept that amendment?
And just to be clear, Chair, that's the amendment for.
That's the clarifying language to make it more consistent across the board.
Through the chair, Councilman Jones, this is in the civil penalty section. The actual, let me just read what the sentence would actually say. It says under 3, the offering by a food service operation on its written or posted menu of a children's meal with the primary or suggested beverage meeting the limitation set forth in Division B is a primary facie evidence of compliance with this test.
Okay, and Chair, is for those who are representing the industry, is that something that is, did we find a agreement on that between the restaurants and American Heart Association?
Ms. McConville or Ms. Watts, do you guys want to speak to that?
Well, this is the first we're hearing about this, Mr. Chairman. I think we'd like to understand a little bit more exactly what the impact would be.
And would also, Mr. Chairman, if I'm sorry, Mr. Chairman, if I may, maybe Valerie or Jamie from the American Heart Association could give a quick comment about that. But this is the first we're hearing about this amendment.
Valerie or Jamie, would you like to comment about that?
Sure. The language on its face sounds fine. The thing we want to avoid, we don't want to make a rule that says you have to serve healthy drinks, but then say that you can still list soda or other sugary drinks on your menu and then just suggest verbally the healthy drink. So I'd like some clarification from Ms. McConville, just to make sure that that's not what we're trying to do here, is insert a little clause that allows restaurants to do that.
Ms. McConville, do you have a comment?
Sure, Mr. Chairman, that again suggestion came from the McDonald's operators, the legal counsel there, and it is it does not create any sort of loophole. They are very supportive of the intention behind the ordinance. So it is simply a change that their legal counsel suggested to clarify compliance. And I do apologize to some of our public health partners on the call. This change was presented to Krisha Ock on your team right before the COVID shutdown. So you all may recall earlier in my comments when I said we had a lot of meetings and a lot of discussions and back and forth, and then COVID just pumped the brakes really hard on this. So I apologize if some folks on the call hadn't had a chance to see it, but again, we believe it's just legal clarification.
Chair, can I say something, Chair?
Sure, go ahead, Councilman Jones.
With all due respect to those who are representing for restaurants and beverages, if I'm not here to, I mean, personally, I'm here to make sure that I'm fighting for the children. If McDonald's, with all due respect, and as a young child, I love McDonald's. Unfortunately, if we left it up to McDonald's to do the right thing in regards of health-wise, we wouldn't be having this conversation. So I do want to be crystal clear that there may be some things that may be a little bit uncomfortable for restaurants and beverage companies to fall in line with, but it's absolutely necessary. And for us who have grown up in neighborhoods where the majority of our food choices came from corner stores and fast food restaurants, then we know the impact that it's had on children who have become adults. So I do want to say I am open, Chair, and I appreciate you for bringing the two groups together. But if we left it to these corporations to do the right thing, then I'm not sure that we would, and this is no representation of the people who are here. I'm sure that they're fantastic people. I know that they're fantastic. I can feel their energy radiating through the Zoom. But I just want to say that I can't leave it up to McDonald's to make the right decision. So I just want to be clear. I want to make sure that I don't want to throw anything. The American Heart Association, for me, is really leading this in a sense of making sure that they're doing the right thing and we're doing the right thing. And I know that these institutions are looking to do the right thing now, especially with the times that we are in. But Chair, I just want to just make that point very clear that I'm not here to be an advocate for McDonald's. I'm here to be an advocate for children. And if they're a little bit uncomfortable, they're going to have to be, because we've been uncomfortable for a very long time in our communities. We're Black and brown people. I've had those supersized fries and supersized Sprites and all, and I've had that. So I just want to make that crystal clear that I don't want this to be about we're just making, trying to make Sprite feel good. No. They're going to have to give up a little bit.
Point well taken, Councilman. And just to let everybody know, I know Dr. Janine Arruda has a point that she would like to make on this topic. It just doesn't seem like the appetite is there for this amendment right now. If it's something that we think we need to really deal with later, we'll deal with it later, but it doesn't look like there's an appetite for this amendment right now, if I'm hearing my council colleagues correctly. But Mr. Ruda, if you have a comment, please proceed.
Yes, thank you, Chairman Griffin and the committee, Councilman Jones. Thank you very much for everyone's efforts towards this common goal, which is to help our kids grow up healthier. As a pediatric cardiologist, as a mother and a member of the community in Cleveland, I see too many children who are overweight and obese. There is no question that sugar drink consumption plays a significant role in childhood obesity. It leads to a high blood pressure. It's a very common cause of high blood pressure in children and adolescents. We heard from everyone's testimony how that increases the risk of developing diabetes type 2, elevated cholesterol, and heart disease. And there is data that shows that some of these risk factors track into adulthood. A child with an elevated cholesterol at the age of 10 will likely have an elevated cholesterol in their 20s. Childhood obesity has become an epidemic in our country. If you look at the survey for the Cuyahoga County survey from 2018, we'll see that close to 30% of children were obese. 40% of our 7th and 8th graders were either overweight or obese. So by passing this policy and adhering to what is being proposed, we'll be able to increase awareness within our communities. And this will be a significant investment made on our children's health to hopefully help them become healthier adults. Thank you.
Thank you, Dr. Arruda. So it doesn't look like that amendment has been introduced. At this time, doesn't look like that amendment has been introduced. So the only thing on the floor that we have left as a council to discuss that we need to make a determination on is the juice size. And Council President has put out a sort of escalation of maybe we give it 2022 until we require the 6-ounce size versus the 8-ounce size. And then there's a recommendation to just move it to the 8-ounce size. Is there any discussion on that, or do we have an amendment that we'd like to propose around that?
Chair,
yeah.
I would say, when it comes to our children's health, there's an urgency, and I just came back from the doctor myself, and the first thing that the doctors ask you is your or one of the first things is tell us about your family history. Tell us about your family history. And I didn't know that diabetes was a part of my family's history, and a lot of times people will tell you that diabetes has a lot to do with the food that you eat. So my thoughts about this is that 2022 is a long way from now. With all due respect, it's a long way from now. I think they can be phased in a lot quicker than that. And especially with a lot of restaurants being kind of slow right now, I think that it's a perfect time to, to begin to implement it. So I'm open, Chair. I'm open to, number one, turning it to from 6 to 8 ounces is fine with me. But what I want to say is waiting to 2022, I don't think will be very good. I think you can look at being a 6 to 8 month phase in, especially with things not being so busy right now. I think it's a perfect time for implementation. But waiting to 2022 and we might lose another 100,000. I mean, you might lose a lot more people during that time. So, that's my thoughts. I'm interested in hearing from my colleagues, but I don't think that this long phase in would be I don't think this is a good thing.
So first, if I could, I wanted to make sure that the council president can put a clarification in place, but then I think Mr. Bowen has a comment as well from the Restaurant Association. Council President.
Thank you, Mr. Chair. I'm embarrassed to ask this question because I did read the legislation. When is the implementation date as written today?
It's Rachel. You're muted. Unmute yourself. Unmute. There you go.
I did it a lot of times in the last couple of minutes and didn't know where I was. Sorry. Through the chair. It is the effective date is 6 months from its passage. So if we pass this Wednesday, it's January. So the implementation date would be the end of January. Is that right? Or the end of December?
And just for clarity, the implementation phase would mean, as written now, that they would have to comply by 6 ounces. And the question that the Restaurant Association is saying is that this would disrupt their supply chain because they actually already have contracts as well as stock of these beverages already. And if they have to move to 6 ounce, then that would disrupt their supply chain issue. Is that correct, Mr. Bowen? If you can clarify that.
Yes, thank you very much. That is correct. For some of our restaurants, some of them already do a 6 ounce, some of them do a 6.75. So 8 would certainly accomplish that and would allow them to, I do know that James said, certainly you can go to Walmart and other places and get 6 ounce, but it is not in the regular restaurant supply chain. It would also make them have to do something totally different for Cleveland than they do for, for the rest of the country. Go ahead.
Go ahead.
Oh, and just, I do want to, for Councilman Jones, I appreciate your sentiment on McDonald's. But I definitely want to let everyone on here know this was not something that they were trying to go around. McDonald's actually goes over and above anything that is suggested in this ordinance for what they do on kids' meals. So this was totally just a clarification and not them trying to get out of anything.
No, I don't, Chairman, to the gentleman. No, I don't believe that. And as an expert eater of McDonald's growing up,
they've come a long way since you and I were eating.
They've come a long way. They come a long way. As growing up eating McDonald's and then watching the documentary Super Size Me, I was very concerned about the chain. But McDonald's has come a long way. They do a lot of great things in the community. And this will be a part of another great thing. Chair, I would say that I make a motion, if it's okay for me to make the motion to, because this is not something we don't want to, and my colleague, McCormick, Councilman McCormick said the same thing. By the way, I love your beard, my friend. this is not about destroying businesses. So that's not what we're looking to do. We're not looking to destroy businesses. So I would be okay, Chairman Griffin, with supporting a motion that would take it from 6 to 8 ounces. I would be in support of a motion in that because we understand that. But at the same time, along with this amendment, Chairman, and this is where the Department of Health comes in, it also needs to be a sense of education for the community. You know, it's also about, hey, now this won't be on the menu, so to speak, but don't you go asking for it either. Because if it's asked for, Chairman, the restaurant is legally okay to give it, right? To sell it.
If they ask for it. But that's what the default is, that if they would actually, you know, say my kid makes the honor roll or something, and I say I want to reward them with a pop or something like that. I call it pop. But, you know, then they do want to give parents that choice. And that's why we gave that clause specifically if they ask for it. But the default is the healthy drinks that we're talking about in place.
Right. Understood. So yeah.
But if I'm hearing you correctly, you do have a motion on the floor, because I
Yes.
want to entertain your motion if that's the case.
Yes, so I want to move the amount of juice from 6 ounce to 8 ounce.
So that's a motion from Councilman.
I'll second that, Council Chair.
Councilman McCormick is a second. All in favor? All in favor?
Aye.
Aye.
Any opposed? Any discussion? Looks like the motion carries to move from 6 to 8 ounces. And keeping the same timing.
Chairman, I would just say, and keeping this conversation going, you know, I would love to see, you know, these two sides continue to work together and figuring out the best ways to bring, and then bringing the fight to our neighborhoods, to be quite honest with you, because the fast food restaurants are one thing, and the restaurants are one thing, but the worst are the corner stores. These are the worst. And it's really harder to regulate that. But that is what's killing our community more than anything. Children going in there and being able to, you know, pick up whatever drink, you know. So I look forward to that discussion. Thank you, Chair. Thank you for your leadership on this, Chair.
Thank you, sir. Appreciate you, Councilman. As we close, I just want to commend this side. I really think this is powerful, that these two industries have come together to craft such a, what I think is a good piece of legislation that can help accommodate what we call our triple bottom line, which is environment, health, and also the economics of our community. So, you know, I really hope that we could also, to Director Gordon's earlier comments, look at how we can look at healthy food options, because it makes no sense to talk about just healthy drinks or sugary drinks if we don't start talking about what is healthy food. We're trying to change culture in Cleveland. We're trying to change the way that our young people grow up in this community. No longer do we want those disparities in place to have the lowest life expectancy. No longer do we want to have you know, our children suffering from obesity and all of those things that Dr. Margaret Larkins Pettigrew said in our city. So I think this was another bold step by this council. I want to give everybody the process that it will now go to the Finance Committee, which is on this upcoming Wednesday. And then once it's voted out of, hopefully voted out of Finance Committee, then it will be voted on by the council as a whole Wednesday afternoon. And then it will become law in our city. Once again, to all of the restaurant owners, we are not trying to be punitive. As a matter of fact, many of us have always stood up and worked closely with the Restaurants Association. I've developed a fondness relationship with Kim McConville from the Ohio Beverage Association, and Scott just hit it off with me last week. So I look forward to continuing to build on these relationships so that we can have a healthy community. That being said, I also want to add that Councilman Tony Brancatelli, if I could, for our attorneys, would like to be added as a co-sponsor for this legislation. So please add Councilman Tony Brancatelli and Councilman Kelly, Councilman Kelly, Councilman Hairston. And then I believe Council President is probably going to wind up being everybody, but for right now, that's who I see who have asked me to be co-sponsors for this legislation. That being said, this
Can
committee.
I ask a question, Chair, before you?
Yes, sir.
I know everybody has to go, but I have a question because we've seen, Chair, these conversations. We fought for, declaring public health a racism, a public health crisis. Major story came out to talk about the fact of how our city has been engaged in this within its own self. And I really haven't heard anything from the city, Chairman. As a member of this committee, I haven't heard anything from the city to say or to address the stories. And I've gotten emails. I'm sure many of my colleagues have gotten emails of people who used to work for the city and said that they have the irony of us declaring racism a public health crisis, and they've experienced it within the health department itself. If there's been a response, I haven't heard it. Chairman, I just want to ask the question, how do you, what's your leadership on this and how will this be addressed?
Sure, and what you're talking about are the stories that we've witnessed about the health department, and I would tell you that there has been an EEOC investigation from the state of Ohio. There has also been an investigation that the mayor has announced, which he's put a team of his administrators with, I believe, Tracy Martin Thompson and Martin Flask and somebody else from his team that are doing an internal investigation. My goal is to hear from the results of that once that internal investigation takes place. Right now, because it is a personnel matter, I'm going to bring that internal investigation to us so that we can hear once they have that conversation. So we do plan on addressing it. We do plan on having oversight from the health committee to make sure that we look into this and do our part. So we will be getting that presentation once that investigation and once that is complete. Okay. All right. So that being said, this Committee of Health and Human Services is adjourned. Thanks everybody for your time. And I look forward, you can join us on this upcoming Wednesday, July the 29th. However, the council president will determine who he would like to just speak on behalf of the teams that are here today. So thank you all very much. If you have any follow-up conversations, please call me. And thank you for all your hard work. Have a great day.
Thank you.
Thank you.
Thank you.
Thanks, Chairman Griffin.